What's up, Charles?
Hey, brother, what's up? Yep, how's it, everybody? You guys up to?
You look exhausted, Charles.
Yeah, they say you gotta use wisdom when you try work and be young, and only to find out that your mind can be young, but your body, whoo, gotta
Yeah,
learn. You gotta learn to act your age, as they say. So it's just tired, 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 tired. That's all I can say.
yeah,
But I'm not a quitter, and you get a good bunch of people, so they shouldn't be penalized. You know what I mean?
well, I try to not act my age. I try to act young, but the body just not happening. You cannot lie to your body. You can lie to your brain,
Yeah,
but you cannot lie to the body, man. The body know that we old.
yeah.
Right? When you old, when you yeah. I had to make a phone call today at work, and I was talking to this young lady. And I said, hey, hi, this is Mel. And I started to start my dialogue. She go, is this Uncle Mel? Uncle Mel Raposo? Uncle, come on, stop already. Tammy got your booster 30 minutes ago. Awesome, awesome, awesome.
Oh,
Congratulations.
good.
I am getting my Moderna booster tomorrow morning at 10 a.m. My wife and my mother-in-law, we're getting our boosters tomorrow. So wish me luck. Hope I don't pass out. Hope I don't pass out. I'm getting anxiety already, Charlie. I'm getting anxiety, but I'm strong. I'm being strong. I'm
Yeah.
not worried about that big needle. They said a Moderna booster, the needle is about that long and about that fat. So I'm not gonna watch. I'm just not gonna watch.
Well, you get nothing to worry about. Because the more you think about it, the longer time going to stretch. And if somebody talking to you better, you just talk story as if nothing wrong. But I
Yeah.
did want to say to all of the hard workers out there, wherever you are, I'm sure you have bosses, some good, some not so good. But I always learn from some time ago. I always learned this, and that is when you get 90 people that look up to you, their future is in your hands. So I gotta make sure that I don't, especially during the holiday season, I don't want nobody going without. So you do everything possibly that you can to make things go smoothly for them, so they can be gainfully employed. I give these people credit, including my staff, my security officers, because they could be like all those other knuckleheads that just would take the free ride, the unemployment free ride. They went down that route. These guys, day in and day out, these guys and gals, they work hard, and I'm so proud of them. And there are many businesses out there. I'm pretty sure their employer very proud of them too. Then when that
Yeah.
unemployment runs out, then they're gonna be crying the blues. Oh, you get work, you get work.
Yeah, I always question that the rewards, our federal government, our state government, was rewarding the people that chose not to go to work. There are some people that were legitimately unemployed that, for whatever reason, their occupation or whatever it may be, there were many. But I can tell you, when I went to Long's one day, I saw a good friend of mine. He was stocking the shelves, and I said, this guy was a hotel employee, really good friend of mine. I said, hey, bro, oh, you changed job? He goes, well, I got laid off. This was early on in the pandemic, and I got to work. I gotta support my family. So he's work. At Longs they get these companies that come in. They're contractors. They don't work for Longs. They work for, I forget what you call them, vendors. And yeah, he picked up a job to help to support his family. And there's many, many, many people out there that did that, but there's many, many, many people that didn't, that could, but they chose, you know what, I'm going to stay home and I'm going to get the free benefits. And I always wondered why the government would reward those people. There were no bonuses for our first responders, police, fire, and of course, how can we forget our doctors and our nurses and our hospital staffs that never had a day off? My wife worked at the court. They never had a day off. They never did. And those people didn't get rewarded. So I question a lot of things. When at some point, Charlie, COVID is going to go away, and or it's going to be managed. We're not there. We're far from there. And by the way, guys, we have Dr. Tim Brown tonight from East West Center, and he is a guru. He is the man, and unfortunately, our state leadership chooses to ignore this man's advice. But anyway, he'll share about whether or not this pandemic is over. But all of these people that worked uh, front line treating COVID patients before vaccinations, before monoclonal treatments, uh, were out there in front, face to face with these people. They never got rewarded. They never got rewarded, and no bonus pay every. So yeah, part of me. So what I was trying to say was, at some point we're going to look back at how we handled this pandemic, and hopefully, God forbid, we get another pandemic. Next generation or whatever, we can handle it better, because it's not better. We are not handling this pandemic well. In fact, you get the Honolulu mayor saying it's endemic, which is a very dangerous thing to say. And we'll hear from Dr. Brown tonight. I really want to get a clear clear definition of what a pandemic is versus an endemic. But you see, a lot of things are said, and I made some notes that I'll share later with the doctor when he comes on about some of the developments that's been going on the last couple of days. I'm concerned. 12 more people lost their lives today. 12, Charlie, and it's like nothing. It's just, hey, 12 more. I just found out that one of the refrigerated containers is being used, and the other two are on standby. They weren't using that for a long time, but it's in use again. And all you hear from our leadership is how wonderful we're doing, encouraging people to go out, relax, go to the football game. Um, Melissa brings up a good point. I don't hold fault for people too scared to go back to work. I blame our leaders. Absolutely, Melissa. Uh, I agree with you. But I still think that there are many opportunities out there for people now to go out and work. Yeah, maybe not in your chosen profession,
Mhm.
but there's a lot of small businesses right now struggling because they cannot get employees. It's unfortunate.
Well, as they say, this this virus has really, you know, kicked a lot of people's okole. But that's just how life is, right? Nothing's ever perfect. Nothing ever comes and knocks on your door and says, "Hello, I'm here. Deal with me." We just learn to deal with it, and you go from there, right?
Yeah.
That's the whole
So
thing. That's the whole thing about. Yeah.
we've seen. So when you think about 12 people that died, and you think about how many people are devastated at this moment, right now, as we are on this show tonight. How many people are grieving tonight because they lost loved ones? 12 individuals, and how many people are impacted by that? I did want to say from Melissa asking, our wonderful friend, lovely sister Kayla Wolf, called asking for prayers. She's asking for the village to pray. Her husband's sister passed away tonight, non-COVID, and they are asking for our prayers. So don't have a name, but we know Kayla. We know Kayla's husband. His sister passed away, apparently a heart attack. Totally healthy, unexpected. So our prayers and condolences go out to the Wolf family out there on the Big Island, wherever they may be. again, death is a rough thing, and that's we got kind of our blessings, Charlie. And
Hmm.
you remind me of that every day, every time we talk. I won't say it. That's kind of exaggerating, but I mean, that's one thing you always remind me to treat life preciously because it can be taken away at any time. And many, I tell you, we forget until something drastic happens.
Well, I'll give you a good example. Sometimes we do things we love, like those fishermen that love to pick opihi, right? Who would ever thought on a calm day, just one freak wave come along, sweep you off the rocks, gone forever, no trace. Who would ever thought that? That's why it's important. Whatever you do in life, even your worst enemies, I would say, ask for forgiveness, even though you don't have to, and you pray for that person too. Because you want, if you have to leave, you want to go with a clean slate or as close to it as possible. You don't want anything to, detour your travels when you go to meet our maker up there. Should something happen, and it's I made this promise to my grandchildren. Who would have thought they would get so affected by seeing their papa in the hospital when I had all those tubes coming out of me when I had my open heart surgery? And from that time on, I told my wife, don't ever let the kids in the room when I there. Because it just broke my heart to see them crying. So, I mean, they had a deep, deep kind of cry. Like I've never seen my grandchildren cry before. And I know they were scared. And I don't ever want to put them through that again.
Yeah, we've all been through that where a loved one is in the hospital. Um,
Yep.
it's again, I frequently often ask everyone at night before you put your head on your pillow to say a prayer for everybody, even those that you don't like, even those that you may have a grudge. Just pray for everybody. Pray for peace. You know, uh, pray for wisdom. Pray for M&Ms for Charlie. Um, I also want to say I'm a big mahalo, big mahalo, Charlie. I
Yeah.
think I speak for Charlie, but I'm sure he'll have a little chime in for our good friend Edwin Sugay over there on Oahu.
That
Uh,
guy, I tell
on
you,
our show the other night, Charlie had
unbelievable.
a beautiful message. Edwin lost his mom, 101 years old. Kiala, real quick, I sorry, but I see this coming up. Kiala's husband's sister passed away from a heart attack, unexpected, healthy, non-COVID. So we're asking everyone in the village to send some prayers tonight for the Wolf family, Kiala and her Ohana. So that's what Kiala is fine, but obviously grieving right now. So anyway, Charlie had a nice little message of condolence for Edwin's family, and that was, I believe, that was on I can't remember what day that was. Maybe on
Yeah.
Thursday. Was it Thursday?
Yeah. One of those.
Anyway, anyway, no, it couldn't have been Thursday. Anyway, whatever day it was, the very next day, I got a message from Edwin. He's saying, "Mel, thank you. Our family thanks you and Uncle Charlie for a beautiful message last night. I'm shipping you over my world famous shoyu chicken, air freight, air cargo, coming to Hawaiian Airlines. It's leaving on the 2:15 or 2:45 flight, whatever it was." So I, it's like wow. So I go to Hawaiian Airlines cargo, and I walk up, and the lady goes, "Hey, Mel." I said, "Hey, what's up? I came to pick up my shoyu chicken." She goes, "Your shoyu chicken had leaked all over the airplane." Long story short, because Dr. Brown is in the house, so I'll just say this: Edwin and the Sugai Ohana. First of all, prayers and condolences for your loss. I know that's tough. I lost my mom. It's rough. But that was so nice and generous of you to pack up that soy chicken. Let me tell you, I gave Charlie his share, and I ate
Oh
soy
no.
chicken for 2 nights in a row, and one lunch in between. It
Hmm.
was delicious. Edwin, thank you, thank you, thank you.
Thank you very much.
So I
Wow.
love this village. Now I'm not asking for anybody to send us chicken or whatever, but that's why I love this village, Charlie. We have become a very strong ohana,
Hmm.
and and one of the members of our village is going to be joining us in about 3.5 seconds. One of our key members of our village is Dr. Tim Brown from the East West Center. I cannot tell you how excited I am and how I was looking forward to tonight all week because we are very familiar with Dr. Tim Brown. He's on the news quite often, sharing his wisdom and his expertise, which oftentimes go ignored. But we're not going to ignore him tonight. We're going to listen and be fed with some incredible information. Dr. Tim Brown, welcome, welcome, welcome.
Good to be here.
I honestly don't even know where to start except at the beginning. Um, I saw your last interview on the news a day or two or whatever, 3 ago. I don't keep good time anymore. But what's going on, Doc? What's going on in the world in Hawaii regarding COVID?
Well, I think, we're in a post-peak phase, definitely. I think the vaccination rate has gotten high enough at this point that it's really helping the situation. Uh, if you actually look at the adults who are eligible for vaccines, the numbers are looking pretty good, above 90% on a statewide level. There's still some holdouts, and I expect there will be. But, probably Delta will infect those people at some point, unfortunately. But that will be unavoidable, and then they'll get some immunity, basically, from that infection. It's not 100% protective. But again, I think, we are in a good place right now in terms of our numbers have come down. They've stabilized at this point. They're slowly declining. And again, I would largely attribute that to the vaccination, but it's also due to the fact that we just went through a major epidemic surge that also removed a number of people from the susceptible population because they contracted COVID, and therefore they've got some short-term protection probably for several months, 6 to 8 months probably, against reinfection. So, I think what I'm concerned about is that we are coming into the holiday season, and people tend to let their guard down during the holiday season. And in countries that have done that around the world, what we've tended to see is that the epidemic resurges. Vaccines by themselves are actually not enough to stop Delta. You actually need some of the other precautions in place. For example, the masking, you need to basically be careful. We need to make much more use of testing than we do in the United States or here in Hawaii for that matter. And so I think, we're in a good place now. Hopefully we will stay there. I'm a little concerned about uh, relaxing restrictions too fast. I think that could end up getting us in trouble, especially with the holidays coming up. But again, I think if people are careful and maintain their caution, then I would hope that we can stay here. We did seem to get through the Labor Day period without too much of an additional surge. So, I mean, it's, we just have, and Halloween went by. We haven't, well, it's a little early to see the Halloween effects. But again, I'm not expecting much because I think people are generally still being quite cautious here. And I think that's the good thing, is that people are being comparatively careful, and I hope that holds up going forward.
We saw Waikiki on Halloween night. We saw the graphic videos of Halloween night right in downtown Waikiki, and that is my concern. I think if everybody behaves, if everybody's responsible, if everybody wears their masks, if everybody basically is careful, then I think we're probably going to be in a good place. My concern is what we saw at Halloween with Christmas coming, Thanksgiving, Christmas, and the New Year's. I'm a little concerned, and with the state, the governor easing the restrictions, and sounds like even more easing of the restrictions are going to be coming up shortly. You think that is going to have an impact going forward?
I think it could, but again, I mean, what I've been advocating for is kind of a slow loosening of the restrictions, not just letting everything go. We're not going back to quote normal as in the pre-COVID era anytime soon. Delta remains an extremely contagious virus. It is still in the community. We know that there is waning of the immunity that comes from the vaccines, hence the recent calls for boosters, which I certainly want to advocate that everybody get a booster if possible. Because there is no question after an extended period of time, uh, after several months, 3 to 4 months, actually, you start to see some waning. For example, with Pfizer, Moderna runs a little bit longer, but still it's starting to wane in the present time, since most people were vaccinated very rapidly, coming up on, almost a year ago, 10 months at this point for a lot of people. And their immunity is waning, and those people should be thinking about boosters, especially because most of those who got vaccinated back in January and February were the older people, and their immunity wanes even faster than other people's. So I think that's important. Again, I think it's important that people who got infected back in January or February already had COVID, not assume that they are protected at this point. They are 6 to 8 months past their infection, which means their antibodies will also be declining. So they will be more susceptible to infection. Now, the good thing is most people will still be pretty heavily protected against serious illness and death, because the waning against hospitalization and death is very, very slow. The vaccines are still probably 85, 90% effective in terms of reducing those outcomes. And of course, they do reduce the infections by about 50% at this point, I would say, is probably a reasonable estimate of where our efficacy is based on a study that just actually came out today that was released in Science based on the data coming from almost 800,000 people from the VA system. And basically what that found was that, yeah, we're seeing about 50% protection against infection from the vaccines, but we're still seeing that 80% plus infection or protection against severe illness and death. So I think, again, vaccines are important, but at this point, boosters are also extremely important. So I think, I really want to recommend, if you got your shot more than 6 months ago, you should be making arrangements to get your boosters, especially with the holidays coming up. I think, it's important that people are kind of at the peak of their immune protection, if you will, as they enter into the Thanksgiving and Christmas season, because that's a period where people are going to be getting a lot of exposure. People are going to be traveling. When they travel, we know they get exposed. We know that a lot of infections that are coming into the islands are returning residents who get infected while they're on the mainland. So I do think we need to worry about that and be concerned about that. So again, now is the time to get your booster if you can. If you're eligible for it, I would recommend getting it going into Thanksgiving and Christmas. Those who become eligible during that period, go ahead and get it, because the boosters will definitely help things. I think the other major change that's occurred recently is, of course, the availability of vaccines for children. And certainly I would encourage parents of children between 5 and 11 to be getting their children vaccinated at this point. That could go a long way toward removing another of the pool of susceptible individuals who could be keeping COVID alive within the community, just keeping it circulating. And so we really want to avoid that.
Okay. Hey, Doc, someone posed this question regarding the deaths that we've been seeing, the numbers we've been seeing in the last couple of days, that compared to hospital admissions and the census of these numbers. What's your take on it right now? Because there seems to be, the the cases reported from before seems to be going down, but then there seems to be a lot of deaths as related to COVID. That
Well, I think
that
the
that's
important thing to remember
Mhm.
is that deaths are a lagging indicator with COVID. Uh, the cases come first, then typically 2 to 3 weeks later, we see the hospitalizations. And the deaths normally occur probably about 6 weeks or so after the cases, because people do go into the hospital. They may spend some time on a respirator before they pass away. And so the deaths tend to lag somewhat. I am a little concerned. I mean, we've actually seen 25 deaths reported in the last 2 days. But my guess is that a lot of that is just a lag in the reporting system, because the Department of Health, I think, saves up deaths sometimes until they can go and validate that they were in fact COVID deaths before they release the numbers. And so I think that a lot of this We go a long period with very few deaths, 1 or 2 deaths a day, and then all of a sudden we have clusters of 10, 15, like we've had in the last 2 days. And I think that's just a delay in the reporting. Those deaths probably occurred over the last 2 or 3 weeks, but they're just being validated and then released to the public at this point. At least that's my guess as to what's going on.
Okay, thank you.
So I wouldn't worry too. I worry about it just in the sense we've had over 900 deaths to COVID in the islands, since the start of this pandemic. That's a very, it's a low death rate compared to a lot of other places, but nonetheless, from the point of view of the families that are affected, it's a very high death rate. That's a lot of people who have died, and we're still continuing to see people die, and that is a real concern. And so I think, the other thing to remember is if you actually look at our statistics, about 67% of these deaths are occurring in people over age 60. So they are still largely affecting the elderly. And that is the reason I really want to recommend that, people in my age range or older, if you can get your booster, now's the time to get it. Because with the holidays coming up, there's going to be a lot of increased potential for exposure to COVID because we know families will be getting together. Members will be coming from the mainland. Members will be going to the mainland. There'll be a lot of travel with opportunity to get exposed to COVID. The situation is far from over on the mainland. People keep talking optimistically at this point, but I'm cautious on that because I've just seen too many other countries where the situation seems to be getting better and then people let their guard down and then it takes off again. So I do think we need to be cautious about that. Some places, actually Europe is really an interesting place. It's kind of a dichotomy. There are a number of countries that were doing very well in terms of vaccination, had good precautions, and then they lifted their precautions. This is places like Denmark, the Netherlands, Belgium, and now they are seeing their cases and their hospitalizations start to go up again. Okay, so they kind of took their pedal off the preventive accelerator, and basically now they're seeing the thing. On the other hand, some countries like France, Spain are actually keeping the precautions in place. They're still kind of, encouraging people to mask. They're still, they're getting their vaccination rates up as well. And they're seeming to be able to hold it down comparatively. And then there's Eastern Europe, which is a complete disaster at this point because their vaccination rates are in the 20 to 30% range. And they're just seeing explosive Delta epidemics right now. So, Europe shows the full diversity of what's possible depending upon how well you maintain prevention. And I do think it's going to be important going forward that we keep prevention in place.
So let me ask you a follow-up question then. So what you're saying, or what you just said, do you think that these countries, the way they relax the restrictions, which now is causing things to come back up again, that they're actually conditioning people to think, hey, we'll go through another phase and then we'll drop off again. It seems like there's this seesaw effect going back and forth, back and forth. And I'm just wondering if the average person takes it well, like, you know what, we've been through this so many times. It'll go, and then we'll get back to normal again. Then it'll come, and that type of thing. Do you think that's happening?
Well, that's what I'm thinking. The problem is there is this constant expectation that we're going back to the way it used to be.
Hmm.
And honest truth, I don't know that the way it used to be was that great anyway. Because the way it used to be, we would go through every flu season. We'd lose between 20 and 50,000 Americans again due to the flu. And with COVID, I would expect probably that mortality rate will stay somewhat higher than that. So even once we reach this kind of, more stable or endemic phase, as they call it sometimes, I think we will still see higher mortality from COVID than we're seeing from something like flu. It will largely affect the elderly. I mean, most of the deaths will be among those who are in the older age groups. So I think that's an important thing to keep in mind. And so I think that, what we really need to take into account is we're going to go. I would not be surprised to see COVID become almost a seasonal thing, just as the common cold is. Some of the common colds are actually coronaviruses themselves. And we know that they have a seasonal nature. And I would not be surprised to see COVID settle into that. It's quite interesting, I think, that where we saw the initial Delta outbreaks in the United States was the south of the country as we were coming into summer, when people were starting to move indoors basically with air conditioning because it was just too hot to be outside. Now what we're seeing, the states that we're seeing going up at this point are the states in the upper north where they're starting to move indoors for the winter. It's getting cooler, so people are going inside more. And again, we're starting, Michigan, Minnesota, Vermont, those states, we're now starting to see the cases going up again. So I do think there may end up being somewhat of a seasonal nature to this. And there will be probably a COVID season, which may vary depending on what part of the country you're in. And that will be the time when I think once we see COVID starting to circulate in the community, I think those of us who are in the older age groups should be thinking about taking more protective measures. We should be thinking about masking. One of the things I'll really give the Japanese, they make good use of mask. If they're sick, they use a mask when they go out so that they don't infect other people. And I think if they're concerned about illness, they will use a mask. And I think we need to develop that habit here in the United States as well, especially those of us who are more vulnerable to this. And that will have multiple benefits. It'll prevent COVID. It'll also prevent flu. It will prevent a lot of other respiratory illnesses. So it actually could improve our public health in many, many different ways. But you don't have to do it all the time. You just do it when you knew these viruses were circulating in the community. That would be the time to think about doing that. But again, that's going to require better public health information than we have right now. It's going to require better access to COVID tests than we have right now. And frankly, I think, one of the areas where the U.S. has really let us down has been in access to rapid tests. I think rapid tests are incredibly valuable. And the value of rapid tests has increased even more, frankly, as of today. Because one of the big headlines in the Washington Post this morning is that Pfizer now has a pill that's just coming out of trials. They stopped the trial early because it was so effective that if given to people early, seems to be preventing almost 90% of hospitalizations and deaths among those who do contract COVID. So I think that that's even more reason why we need to have more access to rapid tests so that you don't have to wait 3 or 4 days for your test result to come back from a lab, which is ludicrous. And you can basically test yourself if you think there's any reason you should be concerned. And if you test positive at that point, then you should immediately go out and seek treatment. Because, we will have these new treatments coming online. It'll probably take, my guess, probably 5 to 6 months before they actually get out there in any substantial way, because they will still have to go through some trial periods. They'll have to get FDA approval, et cetera, et cetera. Although the Brits have already approved the Merck pill. That's about 50% effective. That's already been approved in the UK, so they will be starting to distribute that shortly, I would assume. But once those become available, plus we've got monoclonal antibodies, which we know work very well if you get to people early. But the key to all of these new therapies is you need to get to people early. You've got to get them early in the course of disease. If you catch them when they're about ready to go into the hospital, it's too late. These new treatments are not going to have the impact that they would have, just like monoclonal antibodies probably won't help very much at that point. But they really help if you catch people in the first day or two after they start to develop symptoms. That's the point at which then you really can, do a lot of good with these new treatments. But again, you've got to have testing access. And, I'm still waiting. The president promised us that the cost of rapid tests would be coming down, but I still haven't seen the price drop anywhere. We're already into November, and my understanding was the government was actually subsidizing about half the cost of those tests. So that cost should be dropping from $24 for 2 tests down to about $12 for 2 tests. And he was saying that would come through Amazon, it would come through the drugstores. But again, I've been tracking those prices online, and I haven't seen those prices come down yet.
Yeah, well, early detection will be key, and I think testing, which I really concerned about the dropping in testing. I think you mentioned a little earlier. The lack of accessibility for testing for many people. I think, is while we're seeing much lower numbers than we did during the last spike. Is that a real true depiction of how much virus is floating around here in Hawaii? That is a question for me, because I just don't see on Kauai we have a lot of tests. There's a test center that's open every day, but there's not as many people getting tested. I think a lot of people are tired. A lot of people are not as concerned. But you bring up a good point about all those the countries around the world. You know, with the federal government now opening travel from international travel, and with Hawaii following suit, we know a lot of these visitors are going to be coming from international destinations. And in Hawaii, it's interesting because if they come directly to Hawaii, they'll require a vaccination and a test. But if they connect out of another, once they enter, if they enter into, let's say they come into the East Coast, if they're coming from Europe, and they come from East Coast to Hawaii, then they're not required to do a test and a vaccination. They'll just have to follow safe travel. You think that's going to have some kind of impact to our case counts and our virus exposures here in Hawaii?
Well, I don't think the vaccination issue is there because if they come into the U.S. from anywhere, they have to have the vaccination. And I believe they're required to do the 72-hour test before. Top of my head, I don't recall whether they're requiring a post-arrival test or not. Originally, that was actually recommended by CDC. I don't know if they actually made it into a requirement that 3 to 5 days after arrival, you should be tested. But that may have been a recommendation rather than a requirement. But they will still be required to be vaccinated to come into the United States, no matter where they're coming from. So I think that, that part I don't worry about. Yes, it kind of, can bypass the testing requirement then if they say fly to San Francisco first and stay there for a period of time and then come over here, then they don't have to test to come here because they're already vaccinated. So I do think, personally, I would rather see testing before flying anyway. I think we should be testing people before they get on airplanes because I think that does help to reduce the transmission of COVID pretty substantially, and it reduces the amount of COVID traveling from one place to the other. So I do see some value to that still.
Yeah, I'm concerned about that, and I hope that we'll see. I guess we'll see in the next few months, if there will be any impacts because of the easing of travel restrictions, especially from the international crowd.
Well, I guess, I actually worry a little less about that than many people do, just in the sense that, they will be vaccinated, they will be required to test beforehand, 72 hours beforehand. So I think, and if you're a U.S. citizen, I think it's a 48-hour requirement before travel, so it's even closer. So I do think that that will help to protect us there. The other thing is, I think most of our exposure is actually through our mainland tourist. And
Exactly.
we've never shut down international travel within the United States in any substantial way, despite all the protestations that we shut everything down from China and so on. We never did. And we probably never will. We're not very good at shutting down travel from places. So I think, things have come in. Delta did not reach us by coming from India. Delta reached us by going to the mainland and then coming from the mainland here. And so I think that, our risk is much more from exposure to variants and to infections that are occurring on the mainland than it will be to the international arena. Unless, of course, we get a lot of people coming in from someplace that really has a severe COVID epidemic, but I don't think that will happen. Because in that case, if there's a severe pandemic in some country, the State Department will slap restrictions on them and not allow them to travel to the U.S., I'm sure.
You know, daily I get exposed to just the amount of travelers that come through the airport. And, the state has spent a lot of money putting all these stickers, if people are too lazy to determine what is a safe distance, they put those stickers on the ground and says, okay, stand on this spot and you'll be within a safety net, right? Safety zone. But when you look at these numbers and, like coming through Lihue as an example, we always get a handful for whatever reason. The information doesn't get uploaded. We hear that all the time. It doesn't get uploaded. Or by the time they come and the results come back, they have a positive, or the information still doesn't get there, so then they have to quarantine, but yet they know that the enforcement, and we talked about this on several shows ago, there's just no more enforcement. I mean, The only thing that the National Guard is doing is they're probably monitoring that the thermal testing when people come off the plane, right? And that's about it. There's no visits being made to places where you should be quarantining, just to be on a safe side. So I think the traveler is pretty savvy. They know this stuff, and it gets harder and harder. In fact, there was a comment just made on the thread here that a person put down that in the mainland right now, Hawaii is being promoted like nonstop. That travel restrictions are lifted or have been relaxed. It's much easier. But then you always have that group of people that just will not stay on the rails. They'll try to play it outside of it, and that becomes bothersome. Do you think we should, would you like to see the governor take a maybe a little bit harsher stance, or you think that what
I've,
he's
I,
doing now is okay?
I mean, I've always felt that our quarantine here was a bit of a joke. I mean, it's
Mhm.
never been taken seriously. Uh, and I actually think that's as much or even more of a problem for returning residents than it is for visitors coming
Mhm.
in the sense that returning residents, I think a lot of them are not quarantining. They say they'll quarantine at home, and then they're probably out and about in the community the next day. So I do think that quarantine has never been taken seriously enough, and I think that that has helped to bring a lot of COVID into the state. I think that probably a lot of the community transmission we've seen is probably related to those returning residents who then infected other members of their family, who infected others in the community, and so on. And so I suspect that that's a lot of that. Whereas tourists tend to be somewhat more isolated, if you will. They're not returning into our communities generally, except for illegal bed and breakfast, which are really Airbnbs, which I would certainly love to see shut down completely. But fundamentally, the tourists are typically staying in one area. They're largely in Waikiki, or they're going to the tourist destinations, which is not necessarily mingling too much with the locals, other than those who work there. And so I think that a lot of the introduction to our community basically comes from the returning residents, who probably are even laxer on quarantine than anybody else. And so, yeah, I think we really should have enforced quarantine much more strictly right from the start. I don't know at this point that there's any mechanism to make that happen. Uh,
Right.
I don't think there's any political will to make it happen, and so it really is almost it actually is, I think, on the honor system as to whether people quarantine or not. And these days, I think most people probably don't think it's that important anymore, unfortunately.
Mhm.
Yeah, I think early in the pandemic when Kauai had the National Guard and the police dedicated, our mayor really allocated all the resources to quarantine enforcement, and obviously the proof is in the pudding, right? We had very very low numbers. We had many people get arrested or cited for quarantine violations. Kauai never made it a habit to make press releases on the real flagrant ones they did, but there were many many arrests done because they were out actively checking quarantine residents and visitors. Anyone that came to Kauai got checked. So we
Mhm.
know it works. But again, is there the political will and the willingness to divert that type of resources because it's not cheap? So that is definitely a concern. But I'm looking at my notes over here. I'm sorry. The Honolulu mayor made a statement a couple of days ago last week about we are now COVID is now an endemic here in Hawaii, and I'm trying to get a clear definition of the difference of a pandemic versus a virus that's endemic. And what are your thoughts? Are we? I mean, I'm hearing from everyone else that this pandemic is still here. It's going to be around for a while, and it's going to be a while before it reaches endemic status. What's your take on that?
Well, an endemic virus or pathogen is one that basically is circulating in a population uh, on a routine basis. Now, there is a common misassumption made that endemic means low mortality. It means it's not causing much damage in the community. That is not necessarily true. Malaria, for example, is an endemic pathogen. and it definitely causes between 1 and 3 million deaths a year on a global basis. HIV is an endemic pathogen, and again, it currently is killing about 700,000, and that's in a world in which we have 30 million people on ART, uh, which is preventing their deaths. So I do think that the assumption that endemicity means that it's not a dangerous thing and it's not something to be avoided is a huge mistake. COVID is definitely something to be avoided. Okay, we know still that the case fatality rate typically is up around 1.5%. That doesn't sound very high, but again, that's a lot of people who die as a consequence of that. The vaccinations absolutely reduce that number, and that's a good thing. But we know that there's a huge pool of unvaccinated individuals. I think the US as a whole is only like 57, 58% vaccinated. So there's a huge pool of unvaccinated people in the US that are still susceptible, and eventually Delta will find them. And when it will find them will be when they let their guards down, or when cities and counties and states basically say, okay, you can drop the mask, you can drop all your precautions, you don't need to be careful anymore because now it's endemic. Okay, so don't worry about it. And that's the exact wrong message. The correct message is it's out there. It is certainly still a lethal disease. It is something you want to avoid. Uh, the latest studies are estimating that up to a third of people who get COVID, even a mild COVID case, may have long COVID. That is, they may see symptoms extending over 6, 8 months or longer. We don't know longer because most of the people with long COVID, we've only tracked out to 6 or 8 months at this point. This may be something that actually goes on for years. Because another thing about COVID is not strictly a respiratory illness, it's a systemic illness. And it affects a lot of other organ systems. It can affect the pancreas, it can affect the kidneys, it can affect the brain. So there are a lot of different organ systems that are potentially affected by COVID. And the long-term effects we have not characterized very well at this point. And so, at least knowing what I know, my personal attitude is I want to avoid this thing. And if I have to take extra precautions going forward to keep myself safe, I intend to do that. As long as there is any COVID circulating in this community, I will be wearing masks in public settings. Uh, there's no doubt in my mind of that. It would be foolish not to do that. I'm going to be very cautious being around crowds of people because I think one thing we know about crowds at this point is that they're dangerous. And I'm a little concerned about allowing these large crowds of 500, 600 people in indoor settings, especially if the enforcement is not good. Now, I don't know how good or bad the enforcement is going to be, but I suspect that it's going to get laxer and laxer, just like the quarantine enforcement. And basically, probably within a couple of months, we will have pretty much no precautions occurring indoors at all. And I think that will be very problematic because Delta is still there. Uh, at this point, like I say, that VA study that came out today and several other studies that have come out in the last several months are estimating that overall our vaccines are probably only about 50% effective against infection. They're still 80, 90% infection or protective against severe illness and death, but they're only about 50% on infection, which means that even if you're vaccinated, you can still contract COVID. You will have a milder case, almost certainly, although some people, especially if they've got underlying conditions, may still get a severe case or may even die from it. So even vaccinated people basically do have to worry about those things. So I think that, we underestimate what endemic means. Endemic does not mean you don't have to worry about it. It means that it's in the community, and if it's in the community at any level, then anybody who's at severe risk from it really needs to be thinking about taking precautions. And that's the world I kind of envision going forward, that, hopefully our public health officials will keep us informed of when COVID is circulating in the community, and that basically we will address it as it comes up and let people know, okay, COVID is circulating now. Those of you who are worried or vulnerable, you basically should be wearing your mask. You should be taking more precautions, washing your hands much more often, doing the things that we know make us safer. And frankly, I also intend to do those things because I don't want to get the flu. I don't want to have a cold. I don't want to get, you know, a gastrointestinal thing if I can avoid it. Whatever I can do to avoid getting infected with any of these things, I'm going to try to do going forward, just to be on the safe side.
Good advice. Good advice.
I don't want to get the flu. Believe me. I mean, look, yes, it may not be as deadly as COVID, but nonetheless, it is by no means a pleasant experience. And I definitely get my flu shot every year, and I'm hoping by next year, basically, we'll be giving mixed flu COVID boosters. So you'll basically get one shot that contains both of those, because I think that's really the direction we need, and maybe even throw in a pneumonia vaccine while we're at it. Because we know the immune system can handle multiple vaccinations at the same time without any problem at all. And if we actually put these into one dose, then you don't have to get stuck several times, which is a real non-starter for some people. I'm not afraid of needles, but I know some people are. So
Mhm.
Yeah, there's quite a few of them.
exactly, I kind of freak people out because when they're taking my blood, I even watch them do it. And it's like they're kind of, you sure you don't want to look away? I'm like, nah.
Yeah, I'm waiting for the pill. I'm waiting for the vaccine pill because I'm
They
one of those that
well,
I don't
actually,
like needles.
I think more likely what we're going to see will be vaccine oral sprays.
Yeah.
There we go.
There are a couple of those being tried out right now, and the advantage of that is it kind of delivers it more directly to the
Respiratory.
receptors in the
Yeah.
mucosa that are likely to contract COVID in the first place. So it's kind of starting the vaccination in the right place. So those will come out, and I think, like I say, the other good thing that's coming out recently is these new treatments. I think these are going to be a big help as long as we get people tested early and get them onto treatment quickly. So I think that it's things are improving in terms of our ability basically to treat it, even as unfortunately we're getting worse in terms of our ability to prevent it, just because of combination of COVID fatigue and people getting the wrong messages from a lot of people in public. A lot of misinformation out there on everything, on
Hmm.
masks, on vaccines, on you name it, on COVID itself. Still a huge amount of misinformation.
That is always a concern. This morning, and it was all over the news, the lieutenant governor said that he predicts that by early 2022, the indoor mask mandate should be removed, that our case counts will be down low enough that we'll be able to do away with the indoor mask mandate. Now, I, I don't see that happening. I'm not a doctor, doc. I'm not a scientist. I'm not an epidemiologist, but I can read, and I do see what's happening in other places in the world and other places in our country, and I see what happened. We all do. What happens when, as you mentioned earlier, when we start lowering restrictions, case counts go up. But when a message like that comes out, it creates this impression that COVID is going away, and this is at the same time we see. And I know you mentioned the deaths could be carryovers or delayed reporting, but we also know today from the news that the refrigerator containers are back in use again. There's one refrigerated container being used right now. The other two is on standby. So we know that whether it's delayed reporting or whatever it may be, that the numbers of deaths. Remember, we had a little lull of a few days, but last week we had the back-to-back double-digit deaths as well. So it's kind of concerning when those messages come out that gives the impression that it's act. We're getting through this pandemic, and I like how you put it earlier. We're in a good place right now, but with COVID, as we see from other places, at any given moment that can change if we get careless.
Well, I mean, I am an epidemiologist, and I will tell you that predicting COVID is a fool's game. Anybody who thinks they can tell you what a COVID epidemic will look like even a month from now is basically selling you a bill of goods, because they don't know. It all depends on how people are behaving. It depends on when the when the pathogens are getting introduced. If they're getting reintroduced into the community on a routine basis, that's a problem. And like you say, places we've seen where they've tried to go maskless, they've tried to go, back to kind of pre-COVID days, have almost inevitably seen their cases rise. Now, some of them have seen their hospitalizations and deaths stay comparatively low because they had a high enough vaccination rate that that's benefiting them. But even some of those, like Denmark and so on, that I think is about 80% vaccination, is now actually seeing their cases and their hospitalizations start to rise. And again, The Netherlands, I know, is now thinking about reimposing restrictions again after having lifted them not too long ago. So I think that, anybody who underestimates COVID is basically being foolish. Uh, we need to watch what it does. We need to monitor what it does, and we need to respond accordingly in the community. I mean, if we do start to see COVID circulating extensively in the community again, the entire community should be willing to go back to wearing masks, at least in indoor settings. I think that, that will be essential if we're going to basically contain this thing. Because once we've picked it up, that it's on the upswing, we're already fairly late in the game being infected. So I do think we need to be concerned about that.
When I guess for many out there that have written in, they're and I've mentioned this before. When someone has, I guess, has the mic, right? They're in a position to make a statement, and especially when in politics, when you're up there and you also have a MD after your name. I'm just wondering what is being released and what is being released by other in the medical field and or experts like yourself. There seems to be this great disconnect for some reason, and it continues on and on. And that's the thing that I get worried about because the message will continue. What do you think should be done? I mean, just short of a cease and desist, it the message just continually. Oh, did we lose our friend there?
Yeah,
Can
he's
you hear me?
Yeah, I
yeah,
can
we
hear
can
you.
hear you. We can hear
Yeah,
you. He
Okay, I
just
guess
lost.
yeah,
the video stream disappeared, but that's okay. Can you repeat your question? Because you were kind of
yeah.
freezing on my screen, so I wasn't.
Okay, yeah. I was addressing and individuals, and I'll use the lieutenant governor as a prime example. You know, he's a lieutenant governor. He makes a statement. People will listen. Now, whether they'll believe him or not, that's another thing. But there's this constant message, and yet we have the experts such as yourself and others that have come on that paints a different picture. And this thing continually goes on and on and on. So it seems like a never-ending. Uh, he said, she said, whatever it is. It just continually flows, and yet Mel and I have been through this for almost 2 years, and we've seen where everything has lined up. And basically, what you said tonight, that's where pretty much everything lines up. Why do you think the lieutenant governor continues down the path that he does? That's the question.
Well, I think many people have multiple motivations. I mean, certainly I understand the concerns about economics
Mhm.
and about businesses and the fact that, many businesses have gone under as a result of the COVID pandemic. A lot of others are suffering. And absolutely, I understand the concern about that. But again, I do believe that there are ways basically of conducting business safely. And I think what's important to me is that we continue to do that as we go forward. And, until I'm comfortable that COVID is not circulating on a routine basis in our population and that we were tracking it reasonably well so that we can spot it if it comes up again, I think, it behooves us to keep some precautions in place, especially with the holidays coming up. I mean, let's get real. The holidays are a dangerous time a gleeful time from the point of view of a pathogen
Mhm.
because it gets opportunities to travel all over the country. It gets opportunities to find big groups of people that it didn't have access to before because they're all getting together for Thanksgiving or Christmas. It just, it's feast time for the virus. And coming into the biggest holidays of the year in the next month, even as we've just gotten this thing under control, is very concerning to me because, if we start to see a lot of large indoor groupings where people are dropping the mask or getting careless or getting sloppy, then we are going to see COVID start to resurge. And especially since a lot of people's vaccine immunity against infection is waning. They still won't get seriously if they catch it, but if they catch it, we know that they can also transmit it on at least for the first 2 or 3 days after they're infected. They transmit for a shorter period than those who are not vaccinated, but even the vaccinated still can transmit the virus. So I think that we need to pay more attention, I think, to public health and thinking through these things. And keeping the economy open and public health are not mutually exclusive, as much as a lot of people like to make them out to be. It's just a matter of finding ways to make the places of commerce safer, to make them more effective. One of the things we've done virtually none of in this state, and in fact in the United States as a whole, is work on ventilation. I mean, we've still got schools where we know that teachers are closing the windows so they can turn on the air conditioning. Bad move. Wrong thing to do with COVID circulating. Okay. We have a lot of the reports we've gotten in the cluster reports from restaurants are coming from poorly ventilated kitchens. It's the kitchen staff that's getting it, not necessarily as much the customers. And that's because there's no good ventilation. And we've had nobody really talking about ventilation. It's one of the things I pushed at the East West Center, and we up the rating of our filters in our air conditioning system. We're doing some CO2 monitoring. We're doing a whole lot of things basically to try to improve the ventilation in the building. And I think that, that is something that we haven't paid enough attention to. And it would go a long way toward making our buildings more COVID proof or more respiratory virus proof. So I think they would be helpful in terms of also protecting us against things like flu and other common colds and other things that circulate that way. So if we improve the ventilation in buildings, that could go a long way. But again, it hasn't really been on the radar in the United States. There actually are countries, I think it's Belgium, I think actually requires indoor CO2 monitoring in all public spaces. And if the CO2 levels are not staying low, basically they have to improve the ventilation in the space. So, that could be added to our repertoire. And we haven't put it in there, along with the masking, along with the distancing and so on. So I think it's really, we haven't used everything we know how to do basically to contain COVID. And that's one of the reasons why we continue to see it spreading so badly.
Okay. Thank you.
I think one of when we do spend a lot of time and energy and resources, what we have anyway, since the beginning of the pandemic, is the rush to open up our economy, uh, and mainly the visitor industry. A lot of decisions are made to really allow that industry to try to get back as quick as possible. But the emphasis on the public health and safety, in my opinion anyway, hasn't really taken the front role. It's after the industry. I'm going to share with you, Doc, and if it's not enough information for you to comment on, that's fine as well. But Charlie and I have a source, one of our local airlines, that tests their employees every day, and every day these results are shared with their employees. And I'll just give you some numbers. This is just yesterday, it's interesting because I'm trying to figure out how this is happening and what's happening. So yesterday, for example, 16 employees tested, 12 were positive. On the third, 18 were tested, 14 were positive. On the second, 17 were tested, 13 were positive. And it's broken down further: 13 positive, 11 Honolulu based, 1 Hawaii based, 1 North America based. On the first, 20 tested, 15 positive. On the 29th, 20 tested, 15 positive. 19 tested, 14 positive. 18 tested, 14 positive. 17 tested, 12 positive. Since they started keeping track, and anywhere from 60 to 80% of the positivity rate of these airline employees. What do you make of that? I mean, it cannot be that all of these employees are bringing the virus to work from home. It just doesn't make any sense. And this is every single day. Any thoughts on how that could happen? Oh, I think he's going to try and reconnect. I think son of a gun. I may have to re, re-ask that question. He's texting me on the side. He's messaging me. It's saying that he just lost us. He's going to reconnect.
Okay.
But Charlie, that's a question that I've had for a long time, and we both have talked about it. It's you cannot tell me that all of those employees, are bringing virus to the airlines from home. Okay, all right, we got him back. We got him back.
Yeah, you were
Welcome back, Doc.
like every third word out of your mouth. So.
Okay.
You,
I don't know how much I don't know how much you heard. Um,
they're getting very high testing rates, positives.
yeah, and I'm not
Uh,
sure how much you heard, but let me just real quick, and I'm not gonna forget the dates, but these are consecutive days. 16 tested, 12 positive. 14 tested, I'm sorry, 18 tested, 14 positive. 17 tested, 13 positive. 20 tested, 15 positive. 20 tested, 15 positive. 19 tested, 14 positive. 18 tested. And again, the trend hasn't changed from when they started. In fact, early on they were testing 90 tests, 72 positives. The positivity rate of these airline tests are anywhere from 60 to 90%. And I cannot believe that these employees are bringing virus from home or from church or from the restaurant or this. I just cannot see how that could happen.
how are they testing? Are they testing with PCR or with rapid test?
I don't know. I'll be honest. I don't know. It's
Because honest truth, I mean, at that high, that high sort of rate just does not seem to be something that would be sustainable going forward. I mean, I would.
I don't know where what how many employees they have. You're running out of employees if all of these guys get test positive. Again, vaccinated people who test positive. What do? You got to send them home. I'm not sure, but I guess my
Yeah,
point is that
it seems to me it's somebody ought to check out their testing procedures because those rates sound way too high to me, frankly, on an ongoing basis.
mhm,
Uh, so I'm a little concerned. I mean, it's depending on who's testing, and if they're doing testing on site, there could be some PCR contamination or something going on if they're using PCR, for example. It's very easy to get contaminated PCR equipment if you're not really well qualified in terms of using it. But my recommendation would be have some expert come in and take a look at that because those rates are way too high, and they sound higher than I think would be sustainable, frankly. Because a lot of their employees basically, if they're vaccinated, they've got immunity to that, and if they've been infected recently and they were vaccinated, then they're going to have hyperimmunity at that point, and they're not going to be coming in with another COVID case anytime soon. Because if you actually get vaccinated, then get a natural infection, or the other way around, get a natural infection followed by a vaccination, uh, then your immunity is very, very strong, and you're unlikely to get infected, especially within the next several months. So I think that something sounds a bit fishy to me there in terms of the numbers. And
well, it does, and it's just I'm curious as to find out if these are people that are sick, or these people that are randomly tested, are they asymptomatic carriers? That's what I'm concerned. I guess the bigger question for me is how much of that virus. If let's just assume those numbers are somewhat accurate, even if it's 50% accurate, and you end up with a 40% positivity rate, are these viruses being caught at the airport? Is it at the gate, at the terminal, again? I find it hard to believe that all of these people would be bringing virus from home.
yeah, it seems unlikely to me. It seems to me somebody really needs to investigate that and look at their protocols, look at where their tests are being done, check out the testing lab. I mean, there a lot of problems can occur with these things. I mean, UK, for example, has had one testing lab that's been completely screwing up test results for people, and so people were getting rapid test positives, and then they'd get a PCR, and the PCR would come back negative, and it turned out that one lab basically was screwing up all the PCR tests and always turning back negative results. So a lot of infected people were being told they weren't infected, and then potentially putting people at risk. So there are problems with some of the testing labs, and I think that would need to be investigated. What their protocol was, how they're selecting people is important, because if they're selecting people who are symptomatic, that could explain some of the results there. Uh,
Hmm.
so I mean, it's a lot of different factors that really have to be looked at uh, to understand what's going on there. It's hard for me to
I
comment just because, like I say, the
Yeah,
numbers sound too high to me to be sustainable from an epidemiological point of view.
right. And I did send this over a couple of months ago to the Department of Health because back then they were testing a whole lot more people, and I'm not sure what they did with it. Obviously, I didn't get a response. I will send it again with the new numbers and ask them to take a look.
Yeah, because it seems very, very high.
Hey Doc, let me kind of shift gears, and and talk about the numbers that we've seen in this past 2 years.
Hmm.
We started off low, and one time we saw numbers that we thought we'd never see. Got into like 400, 500. One time was 1,300, right? And you come
Yep.
down. So, do you think that many of us, including myself, sometimes we really don't know what the numbers mean? Because all we know that if numbers are big, ooh, we jump back, right? If numbers are small, okay, we can relax a little, that type of thing. Do you think that sometimes we skew the numbers and we look at it in a wrong sense? Because I'm sure there's a value in it, but I just don't know if basically I'm interpreting it correctly.
Well, I think, I mean, when you're seeing the high numbers that we saw during the Delta peak, I mean, absolutely something's going on. And, you absolutely need a public call basically for people to take extreme precautions at that point. It means the virus is spreading very rapidly within the community, and I think that's a real issue.
Hmm.
So, absolutely, when the numbers are high like that, it absolutely needs to be getting out there. Uh, I think my concern is that as we move kind of into the next year, that there's going to be a tendency to stop reporting those numbers, to stop informing the public about those numbers, and I
Hmm.
think that would be a huge mistake. Because then we can end up with a lot of COVID circulating in the community, people not knowing about it, so they don't take precautions, and that makes it even worse. Uh, it's also a challenge in that because vaccinated people who get breakthrough infections very often are asymptomatic,
Hmm.
uh, there could be a substantial number of asymptomatic infections in the community that are potentially infectious. And so those people wouldn't be going in for testing. They wouldn't be, doing much of anything at that point. And so I do think, it's going to be critical to maintain our surveillance going forward and also maintain our public health notifications to the population about it. People need to know what's going on in terms of COVID. They also need to know what's going on in terms of flu and other things. And I think that, if there's one thing I hope we've learned out of this pandemic, it's that we need to improve our public health messaging. I think from the start here, we have not had good public health messaging. We've not done a good job of informing people about what they needed to do. We've not done a good job of informing people about what's actually going on. And part of that challenge is that, yes, the science is evolving because the virus is evolving. And that has left people confused.
Hmm.
And I don't think that our public health officials have done and I'm not just talking about the state, I'm talking about the federal level. At the global level, WHO has done a pretty bad job too, I think, in terms of informing people about what they need to be informed about. So I do think that we really need to improve that. One example is ventilation. We've done virtually no messaging around ventilation. We should have been doing that because we've been dealing with this epidemic for almost 2 years now. We should basically have we should have retrofitted practically every building in Honolulu for improved ventilation, so that we reduce the transmission of respiratory pathogens through our air conditioning and our ventilation systems. And yet, we haven't even talked about that at this point for the most part.
Hmm.
So I think, we haven't done a very good job of doing everything we could really to contain this, to reduce the transmission of this particularly nasty virus. And that's one of the and you know our public health people completely missed Delta. You know, some of us were screaming about Delta from May, that, this is coming. You better prepare for it. Do not drop the mask right now. I mean, I know there's a whole group of us who chat regularly. And, when CDC dropped the mask requirement for the vaccinated, we said this is the stupidest thing we've ever heard of. This is exactly the wrong time to do it because we know that Delta is coming. In fact, we were watching it sweep across the United States at that point in time. And CDC saying, that's okay, drop the mask. So, yeah, I think our public health messaging has been terrible and it's confused people. And I think, we need to get much clearer message out there. Let me get a clear message out for people right now. Get vaccinated. It's absolutely essential to reduce the risk associated with COVID for you and your loved ones. Number two, if you're in crowded public spaces or indoor spaces, wear a mask. It's still necessary at this point. When we reach the point that COVID is low enough that people can call for taking the mask off, I think that's the time to call for it. Do not put that message out now. And don't try to set stupid metrics about masking. Encourage people to stay safe as we come into the holiday season. Okay, what do I mean by stay safe? I mean, first of all, if you're not vaccinated, get vaccinated now so that by the time you get together for Thanksgiving or Christmas, you've at least had your first shot. Okay, that first shot will give you a lot of the protection against illness and death. It won't give you as much protection against infection as the second shot will, but it will still help. And it takes about 2 weeks for your immune system kick in on that. So if you're not vaccinated, get vaccinated now going into the holiday season. If you need a booster, get it now. This is the time to get it because you're coming up on Thanksgiving and Christmas. You're going to be getting together with a lot more people, almost certainly. And that's the time when you need to be careful. If you've got people coming from the mainland, make sure they're tested before they get on the plane. Make sure they get tested after they get here. If you're bringing people into a large gathering, if you can get your hands on rapid tests, give everybody a rapid test before the gathering.
Mm-hmm.
The rapid tests are incredibly good at catching people who are contagious. Okay, that's the important thing about rapid test. When your viral load is high enough that you are transmitting COVID, the rapid test will pick it up with about 98% accuracy. Okay, so it's very, very good at catching people who are able to transmit the virus. And so use those before a large family gathering, especially if you've got people coming from the mainland. If you've got a cold or the sniffles or the slightest thing on Thanksgiving Day or something, don't get together with the rest of your family. You're potentially putting them at risk. And don't assume it's a common cold, because we know COVID has the same symptoms as common colds, as influenza, as a lot of other things.
Mm.
Okay. So if you're sick on that day, please just stay home, stay away from the rest of your family, and get a COVID test. A rapid test will be fine at that point, especially if you're symptomatic. The rapid test will pick up if you're COVID infected. And so I think, just take precautions because, it's not over yet. We still have the potential for a lot of transmission to occur, even among those who are vaxxed at this point. But if we're careful and we take the appropriate steps, we can be getting together safely. We can be doing safe gatherings. And I think that's what we need to be doing. And I think we just need to make the messaging very clear about that and not talk about, we're going to throw the mask away in January or February. Don't even talk about that now. We don't know what's going to be going on in January and February. So this is not the time to be talking about it. And also to create this anticipation that, throwing the mask away is a good thing is also casting aspersions on masks. And frankly, like I say, I really hope that we start to adapt behaviors that are much more like the Japanese, where if you're sick in the slightest and you're even thinking about going out of your building, wear a mask. If you're worried about contracting something, wear a mask. I really wish we made much more use of masks going forward and also improve the quality of our mask as we go. So I think that, it's going to be a lot on the individuals because we know that the mayor and the governor and the others are going to be lifting restrictions, sometimes in ways that are too rapid. And then it comes down to personal responsibility, basically trying to protect yourself and your family. And I think that's what people need to do.
Okay.
Boom.
Yeah.
Damn. I was just going to ask you for some closing comments. You hit it on the head. I think, Doc, while it's foolish to predict what may happen in January, we 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 know with a pretty high level of certainty, based on what's happening around the world and other parts of our country, Hawaii typically trails in that, and we typically will see the similar activities happening here. I think that's happened more than enough times that we can actually consider it a trend. That what we're seeing happening in other parts of the world or other parts of the country, and we see government's reaction or inaction, and we see the results. We can be safe to assume that if we follow them and do what they're doing as it relates to restrictions, that the outcomes will be the same. I, I think it'd be foolish not to realize that if we do what they do, we will see the same result. But I like your comment about not trying to predict where we'll be in January because we just don't know. We
Yeah,
truly
we
don't.
don't know. And it's going to depend on what happens over Thanksgiving and Christmas, quite frankly. And, I I'm hopeful that we have enough immunity in the population at large now that we can manage to get through those holiday seasons with a comparatively mild surge. I think there'll still be some surge. I think that's almost inevitable with the gatherings, with the movement around the country that we will be seeing. Like I say, we know that states like Michigan, Minnesota, Vermont, the northern states now are starting to come up. And that's where the snowbirds are going to come to Hawaii anyway, because they want to get away from those cold places. So there will be additional COVID probably coming in here, and absolutely, I think having the 72-hour test requirement is still a good thing and should be kept in place. But where we are in January, we will know in January. We will not know prior to that time. And I think making predictions about what we're going to do in January is really rather foolish at this point. So let's just do what we can to get through the holidays safely, to keep our businesses open but safe, which I think is still quite possible. We know how to do it. We just have to have the political will and the willingness to go ahead and take the precautions necessary to keep us safe through this pandemic.
Hmm.
Thank you, Doc. Appreciate you. I know Honolulu opening up bars and restaurants to 100% capacity. I'm a little concerned about that as well, but we'll see. We'll see. Hope I'm wrong, but that
Well,
is.
you're not going to catch me going to restaurants anytime soon. I mean, I honestly still see them as dangerous places right now, even if you're vaccinated, because the aerosol transmission is real with COVID, and a lot of people in an enclosed space generates a lot of aerosols, especially if they're talking loudly or singing and doing other things that people tend to do in bars and restaurants. And so, it's not the safest place to be.
Well, Doc, thank you again. Appreciate your time. I love the message, man. We're blessed to have you. Charlie, any closing thoughts?
Yes, one big thought, and that is thank you so very much, Doc, for coming on tonight and giving a real simplistic play-by-play uh, overview of what's happening. Because, like I said, I was one of those that was wondering, hey, am I reading this thing wrong or what? But you made it perfectly clear. To our viewers out there, thank you for the questions that you posed. Sorry we didn't get to all of them. Were kind of well, I know I was kind of selfish tonight, asking certain questions that has always been nagging at me, and I'm so glad that we had this esteemed doctor with us to kind of clear up, especially for me anyway, clear up some of the questions that I had. And he said something that is so true. Way back when I was in the police department and we would extradite, back then Aloha Airlines flew inter-island, and I would be involved in extraditions from people that ran away from Maui, and we had to go and get them and bring them back and so forth. I always saw our Japanese visitors with masks, and I thought way back when in the 80s, I said they're crazy, they're crazy. But look at it now, and they were onto something way before all of this. So I think I'm one of the believers that masks do work because I haven't gotten a cold, and I encourage all of you for now. If you bought a stockpile of masks, just use it, but keep yourself safe and keep others safe too. Okay, don't try to fight this thing. This thing hopefully will die out on its own when everybody takes the right precautions, and everything will go well from that point on. So again, thank you so much for joining us, Mel.
All right. Thanks again, Doc. Appreciate your wisdom. I really do. I think you reinforcing for our what we call the village, reinforcing what we know, and it just like Charlie said, you do it in a way that's very understandable. Appreciate your time. Your closing comments, I think, were spot on, and I think that's where people personal responsibility is going to really what gets us through this. It's not going to be, you don't need a mandate from the governor to wear a mask. You don't need that. I mean, if you want to be safe and protect others that you love, then we got to do what we got to do. And the vaccines are there. I'm getting my booster tomorrow. I'm excited, actually. After listening to you, Doc, I really am excited about showing up tomorrow at 10 a.m. to get my shot. I really am. You just made it seem like That's what we got to do. And for those of you that are not into vaccines, consider it. If not, please, guys, be safe. Practice safety everywhere you go and everything you do. So, to the village, thank you guys for your patience and listening tonight. I hope you guys got some good nuggets of information. We'll be off on the weekend. We'll see you guys back on Monday night to talk about, guess what? COVID. All right, people. You guys take care. Stay safe. God bless. We love you guys, Doc. Enjoy your weekend, man. You deserve it. Take a break.
Thanks, everyone. Stay